my last lecture is going to be attention deficit hyperactivity disorder. So ADHD, this time we're going to focus on assessment and management. The last time it was on the diagnostic criteria. Okay. So ADHD is the most common behavioral condition in childhood. You see it in 4 to 6% of children and adolescents. Boys are more affected than girls, 2 to 3 times as much. And the symptoms are inability to regulate, a heightened level of activity, inability to attend to tasks or inattention, and lastly, poor impulse control. Then, from our last lecture, we know that in the diagnosis of ADHD, the diagnosis must be before the age of after the age of 4 years old. The symptoms have to be present by the time that they are 12. The symptoms are 6 out of 9, this is the diagnostic criteria in children, and 5 out of 9 from 17 and older. And the symptoms must be observed at least 6 months in 2 settings. So just to review, these are inattentive symptoms as we reviewed the last time, and these are our hyperactive symptoms. So ADHD is diagnosed based on the clinical history in the aid of assessment tools, which includes your Vanderbilt assessment form. So I brought with me the Vanderbilt. So for each row, I need to share with you the Vanderbilt forms, okay? And then, kindly pass this to the back. So if you notice, the Vanderbilt is an assessment tool that has 4 pages. The first 2 pages include a parent form, and the last 2 pages involve a teacher form. So there are 55 questions for the parent and 43 for the teacher. No? And then those symptoms which are described in Vanderbilt are rated as 0, 1 to 3. 0 if not at all, 3 very often. Okay, so what is significant here, when you say in a positive ang symptom, is by using 2 and 3. So if the parent rates 2 and 3 for a particular symptom, it is a positive symptom. So we talked about 6 out of 9, 5 out of 9, so how do you get that? So 1 to 9 are your inattentive symptoms. Okay, 10 to 18 are your hyperactive symptoms. And if, based on that feedback on 2 settings, in the last 6 months, the parent and the teacher both describe 6 out of 9 for a child, or 5 out of 9 for an adult or an adolescent, then you have the criteria for ADHD using the Vanderbilt form. Okay? So, apart from ADHD, the Vanderbilt also assesses oppositional defiant disorder, conduct disorder, anxiety, depression, and academic performance. So, after number 18, as I mentioned, it is up to 55 in the parent and 43 in the teacher. You will see other criteria that will emerge based on the different differentials, which may include oppositional defiant disorder, conduct disorder, depression, and academic performance, masking as symptoms of ADHD. And then there is another one called the Connor scale. So the Connor scale is similar to the Vanderbilt, although it is more specific as to age and gender. And then the recommendations for treatment differ from different age groups. So as you diagnose earliest at 4, between the ages of 4 to 5, it is behavior therapy. And to demonstrate this, I have found a video which may be helpful. Okay, which will describe cognitive behavior therapy.
When a child has been diagnosed with ADHD, the first course of treatment is to try to change some of the challenging or functionally impairing behaviors for the child. Some of these behaviors include the child drifting off and not paying attention, or maybe a child that can't sit still long enough to focus on homework or on classroom assignments. It's really important to have the intervention of parents and teachers and the whole school team on board to help modify some of these behaviors. For instance, a teacher might help the child learn how to self-monitor their own actions and provide a little incentive plan to help a child remember not to interrupt but to raise their hand. It's important to recognize that a lot of the behaviors or the more negative behaviors of ADHD can be modified and shaped, and the child can learn to control them. Working with a good healthcare professional, a child psychologist or social worker, can definitely help parents come up with an individualized behavior treatment plan to help their child's ADHD symptoms. So these are just some of the behavioral strategies that can be used in decreasing ADHD symptoms.
So that short video describes cognitive behavior therapy in children. Okay, and then let's now move on to other forms of treatment. Okay. So again, from 4 to 5 years old, it is behavior therapy. Then we have medication as an intervention for 6 onwards. So medication is based on, if you remember, what is the neurotransmitter responsible in ADHD? It is dopamine in the prefrontal cortex. No? So what the medication provides is dopamine in the form of methylphenidate hydrochloride. Okay, so methylphenidate hydrochloride is Ritalin, and the other brand name is Concerta. It is available in our setting in 10 to 20 milligrams. Concerta in increments of 9, 18, and 27. So I'll take one out and maybe you can just see what it looks like. So it's a very small tablet. No, it's the size of your diphenhydramine. Okay, if it's taken correctly and then the child responds to it, according to literature, 90% do respond to it, and you have an immediate response within 30 minutes. So what happens is that you have the increased attention span from unpreferred activities, your level of activity is regulated, and your impulse control is much better. It can be abused in certain cases, such as in exams, because it does increase your attention span, and concentration is improved as well. And I understand also retention is also improved with Concerta. So in some cases, like say when you do take medication, you might find there is a paucity in its supply during board exams and bar exams, because it can be used to take better exams. Okay, so I'll just show you around. There is one that has been removed, okay, but you can just see what it looks like. Okay, so just to give you an idea. And then in adolescence, so we talked about 4 to 5 years old behavior therapy. In elementary, it's medication, and also possibly cognitive behavior therapy still, preferably both. And then in adolescence and adults, it's medication. So let's review. So in the assessment of ADHD, use an assessment tool called the Vanderbilt, which I showed you earlier. And so see what it looks like and how it's supposed to be interpreted. And then secondly, we talked about the treatment options for ADHD. So from 4 to 5 years old, it's cognitive behavior therapy. From 6 to 11, it's a combination of medication and cognitive behavior therapy. And lastly, in the adolescent and adult, it's mostly medication as an intervention. Thank you for your attention.